ministry, stress of church members, stress of the family, stress of who again? Ministry, economic stress. Ah, wow, that's another community stress. There's a lot of stress that surrounds us. And when we are talking of stress, stress is a normal thing that every one of us needs to experience. There are some, if they don't experience that stress, they won't appreciate their body. Do you believe that? There are some, until they experience that stress, whatever you come to them to do, that is when they can get to you. Psychologically, they will not be balanced. Emotionally, they will not be balanced. But they want to pass through that stress. Passing through stress is not the problem. But the problem is we ourselves. I was chatting with one of my pastors this morning. I said, you took your time to rest. He said, yes. How many were in that room? Come on, the pastor, she back. And when we look at the pulpit or the podium here, it's not meant for death. It's not meant for death. It's not meant for somebody to collapse or slump to death. That is where you need to watch it. A lot of our pastors, when they are passing through stress, like they need to dedicate things to the church members, they will still put everything on their heads. When they're supposed to rest, they will still do what? Pack everything on their head. So everybody are meant to pass through stress. But how do we handle the stress? What are the symptoms of stress? We have difficulty in sleeping, we call it insomnia. Difficulty to eat. When your wife cooks for you in the morning, around 7 a.m. or 8 a.m., and you are telling that woman, I'm not ready to eat, and you are not fasting, check yourself. There's possibility you are under stress. Your body is not giving you the sign that this person put something in your mouth. Then the body is what? Is giving you signs of stress. Another one is weight loss. Weight loss. Pastor Emmanuel, ṣe olúwa yìí náà nù. Pastor, wọ́n ní kò yíyí máa ń jọ díẹ̀ agbọ́dọ̀ gbàdúrà lóko, agbọ́dọ̀ gbàdúrà lọ́sàn. We are not saying we should not pray. We are not saying we should not seek God's face. But we should try to manage ourselves so that we will not complicate issues. And when you look at this brain, you look at the heart, you look at the part of the body, the whole part of the body, they work together. Before you can say anything out, your brain and your heart will communicate. And from there, your mouth is able to do what? To say something. But when these two things are not working together, there is no how you can communicate. So it means a brain that does not have sufficient food, there will be a problem. And that's why you see some pastors looking marasmus, looking at somebody like having kwashiorkor, looking at somebody that is taking ogogoro, one side white, the other side with a macheted. The hair will look like 4 colors. We have white, and black. Then we have another color. Someone was telling me that it's very Tuesday. So for us not to be having issue with this, we should be able to control ourselves. Another thing is headache. Headache will be coming up. I woke up early this morning and I was having severe headache. I noticed myself that I'm really under stress. So we should monitor these things. If you are able to see that you are having headache, take your rest at that time. See if the headache do what we go. Now, if the headache refuse to go up at that time, go back to your sleeper. call your mind together, then sleep again, and see if that headache will do what will go. Now, if the headache refuses to go again, that is when you need medical attention. Another one is persistent low grade of depression. A lot of pastors are passing through depression, and due to these health challenges, due to stress that we have not managed well, a lot of pastors are going through depression, and that is why we should be our brother's keeper. Don't see that this person is doing fine. Hello, brother, how are you doing? That's only how you doing. There's possibility for that person to voice out. If it's a friend that you have called for a long time, just call and say hello. When that's hello, that person is ready to do what? To say something. So a lot of pastors are passing through depression. And this depression we are looking at, Nigeria, I think, can control. We don't count things like aged person, don't back them from, and àgbà tí ń dé, àgbà tí ń dé gbà mí, ẹlòmíì kan ní kó kàn lọ hospital, wọ́n kàn fún lókun ẹ̀yọ̀ kan, ó lè má ju bí kò lọ. Nǹkan tí àwọn àbúrò kan bí bí ti wà nìyẹn. Once they see that, mama, what is your name? And she's mentioning my name. Then once he pick the pay, something is wrong with this and mother. Immediately they move the person to the hospital. But here in Nigeria, over 60, àgbà tí ń dé ní age 60, àgbà tí ń dé. So please, when we see that we are passing through something that is making us to look depressed, then we should do what? Move to the hospital. What are the solutions to challenges of stress? Number one, we should have a good diet. We should have a what? A good diet. My father said, when last did you eat vegetable? Yesterday. Vegetable and what? And semo. Register.
Oye ilá.
Ilá.
Àti fufu.
Àti fufu. Do you have any Igbo among us? Igbo. No Igbo. Now, Igbo, what did you eat yesterday? Now, I want to bring out something. Looking at Yorubas, Hausas, and Igbos, we have difference in eating, in diets. Now, when you bring a patient to the hospital, where I'm working, if we have an anemic child, like 10 or 15, it's hard for you to see an Igbo person among them. Where I'm working, if we have 15 anemic patients, like those who that need blood, we have 15 of them, you cannot see one Igbo. And that is shaking head. Reason is they take a lot of vegetables and they have a lot of adequate diets. One of my boss, Tabari told me one day, she will cook beans. You know, beans here, you see different vegetables like soup. Now, that beans, ẹ̀jẹ̀ láàárọ̀, ẹ̀jẹ̀ lálẹ́, ẹ̀jẹ̀ láàárọ̀ ọjọ́ kejì, ẹ̀túnjẹ lálẹ́. The third day, the next soup she will cook is a vegetable. Ó máa ní ngú nínú, á ní efirin, ó lè kó bí mẹ́rin sí márùn-ún jọ. Nǹkan tá a máa ń jẹ, ó lè jẹ́ nǹkan tá a máa tún jẹ fún mi 2 days nìyẹn. Please, let's balance our diet. This sugar we are shouting. Most of this is caused by our lifestyle, what we put in our mouth. Some may have hereditary, but that hereditary will not come up. It triggers it with what we take. So let's try and balance our food. If we have adequate diet, even when we are under stress, something will supply your brain, something will supply your body system. But when you have stress and you are taking, like when I'm working, they can eat by the morning with omiobe, people call it omiobe, with omiobe. In the afternoon, they will take garri, they will soak garri, they say they are used to it. At night, they will come back to that same eba or fufu and they will take it with omiobe. And that's why they come up every day with anemia. I've not seen a shift that will run them that they will not come up with anemia. Even we are like, maybe we should go to the city and do some education to them. But these people are elites. We have elites among them. But we Yorubas, we are not mindful of what we eat. If it's rice we are cooking, add beets to it. We have adequate diet. We cannot have balanced diet, tabanically balanced diet, and powerful rawani. Because that thing I must say balanced diet, we are sitting, you actually not told before 4,000. See, 5,000. But what we have around us, we can bring it together to have an adequate diet. Another one is commit yourself to regular exercise. Commit yourself to regular exercise. Now, I'm coming down to church from the bus stop and I want to get here under 5 minutes. Am I under stress or under exercise? Under stress. Exercise. Stress. Under stress. Exercise. You are not saying exercise, yes. Oh yeah, any other person? Yes. It's exercise. I have to get in the next 5 minutes. It's stress. It's stress. When you are talking of exercise, exercise is things of mind, not the things of under a pressure. And most of us, we are at other side of this. Actually, no time because of work. Like 10 people, before we can see one person saying he or she stroll around the compound is difficult. When we pass through stress, it does not mean we should not pass through exercise. Exercising ourselves is like we are relaxing ourselves. It's somebody like they want to have sex now. But will the person enjoy it? The person will not enjoy it because almost are running, upside father. Same thing to exercise. So please, we need to exercise ourselves. This BP we are talking of, this sugar we are talking of, if we can exercise ourselves, there is possibilities for sugar to break. But when you take food now, the next thing, busy, manage kini to one there. One of the two and then you put your leg on the table here. The one you are to one over your line. Or accumulate adipose tissue fast. So please, as pastors, we need to exercise ourselves. Whatever we are preaching must be something which we are doing. We should not make ourselves to be on a stressful way all the time. Have time for enough sleep and rest. I'm sure if I ask that question here, maybe like 2 people will say they sleep for 7 hours. Is there anybody that slept for 7 hours? You slept for 7 hours. But you still look stressed. Any other person for 7 hours? 6 hours. 6 hours. Who manage it? 5 hours. Somebody can say this wish. Ojú ọ̀run ó fẹ̀ gbogbo àdàlà ní nọ́mbà ń bẹ̀. Oníkálùkù ó ti gba tíkẹ́ẹ̀tì ti ẹ̀dá ní. Ẹ má bínú ẹ̀yin pásítọ̀ gbò. ẹ má jẹ́ ká ṣe Jésù léṣe. If we don't rest, if we don't sleep the way we expected to sleep, it will speak on us. Even this memory may not be able to do some things. When I'm overstressed, if you ask my name at that time, me need a phone. If you ask me what I ate yesterday night, I may not be able to give you because I'm under stress. And that is why we are having a lot of dementia patients. Tell me, mommy, oh, 4 hours long. That is the reason we are having a lot of dementia patients in Nigeria. Because we don't have enough rest for this break. And let me chip in something concerning this sleep and rest. Now, when we wake up in the morning or midnight, we discover that a lot of people, they just say, "Anyway, also go watch." Bó ṣe bó sùn kò kàn jí o, ó jí, ó bá lókù. Tó bá pè èèyàn láti tó bá sáré pè èèyàn pé Pastoral lágbájá tó bá jí lójijì, báwo làyà ṣe máa ṣe? Ṣé nígbà tá à ń sùn lọ́wọ́, the brain is anemic. Òun náà rest at that time. The heart, òun náà sinmi díẹ̀díẹ̀, ó mí fún wa nítorí pa gbọdọ̀ ní. But that brain is resting. Now when we wake up, it will take for these two things, it will take time for these two things to connect back. When you wake up with immediate something, check it. You will see that you cannot remember anything. The brain is not working at that time. But by the time you take your time to rest a little, the brain and the heart will connect back, and that is when the body system will start another journey of life. So please, when somebody call us, take your time to take a little breath, then you come now, don't just jump up. Jump up by. From there, at least I've seen it issue last time. I saw it. This is a practical thing. My father knows about it. In my registrar trainings. It was a practical thing. Thank God I was at home that night. I don't know what would have happened to my husband. So please, when we wake up, make sure you have a balance of your brain and of your heart before you jump up. God will help us in Jesus' name. Find a mentor and a counselor that you can pour your heart for. Don't keep everything to yourself. Sir, ẹni tí o bá ní mentor, ṣé lè ṣáìpé yẹn tó máa dà? Kò ní dàbí. Because that person is not really balanced psychologically, and the person will be under a pressure. But when you have a mentor that you can talk to, that person will advise you. Ó ti mú díẹ̀ kúrò nínú stress yẹn. Nínú 100%, ó ti àwọn 20 kúrò bẹ́ẹ̀. Ó máa mú 80. Tí ọba tún bí ayàwó kí èèyàn tún bọ̀ wá nílé, kí èèyàn tún ṣe kí èèyàn tún pọ̀ ọ̀gá. Then it means that the father and the mother must be in a good condition. If father and mother are not in a good condition, there is a problem. Because the load will be on either of them, which will be pressing the person down. Ẹ̀rọ tó ti lóògbé bá ti wà lórí èèyàn, ọmọ máa ṣe kíni, a máa dáàbò ọ̀rọ̀ báyìí, títí táwọn èèyàn máa fi kó wọlé, kò ní wọ̀n. Daddy, you are doing well, not on our song. God will help us in Jesus' name. So our ministry should not be alone, should have a mentor. Whatever we are passing through in the church, kò sí ìjọ Ọlọ́run kan tó wà, especially Baptist, tí pastor bẹ̀ ò ní issue pẹ̀lú àwọn kan. You should have somebody you can have discussion with. Live in harmony with God and peace with others. If you with people. Aya ò ní já o. Tó bá ṣe yẹ pé àwọn ló ń họ̀tẹ̀, at least you will still be able to free yourself. But when we are not in good harmony with people, there will be a problem because the stress, the workload will be too much on you. Then you have a good friend, a positive-minded person. When we back to our house, one of my friends, he said, ṣé ọkọ kan nìyẹn? Mo ní kí ló wá kàn? Ó ní bísíǹsì ni. Okay, mo kó dẹ̀. So I don't want to be following week àbí 2 weeks after. Mo bá gbọ́ fóun náà ti lọ ra lẹ̀. Wọ́n ó yẹ kémi náà béèrè pé wà ní ìṣe kan tó kàn nìyẹn. So gbàtàrà mọ́tò òun náà lè padà wá béèrè pé ṣé nǹkan tó kàn nìyẹn mọ́. We should know the kind of friend we are meeting. Mo lè lọ sí ọdún yẹn mo gbàdúrà kan mi lọ́bi tí mo wà fine tí mo gbàdúrà yẹn pé tọ́lé prayer yẹn pé Olúwa disconnect mi pẹ̀lú ọ̀rẹ́ tí ò fẹ́ fi wéré. Ọlọ́run dẹ̀ disconnect wa lóòótọ́. Connection yẹn ṣẹ́ni gáàpù wà mẹ́sìn training ló gbàdé. So have a positive friend. Don't just have friend. Somebody that have a mind like you. Take break. Pastor, ẹ̀yin dábì wa, ẹ má bìí ṣe ló máa bèrè question yẹn sí. Dábì báwo ni bíbí sà? Báwo ni bíbí sà? Yàrá mi bàtà ẹni mi sà, bíbí ti ń kọ́. Dábì wa. Occasionally, dábì bíbí. Jọ̀dá ló ti lọ ní ìlú ọdún yìí.
Mo ti lọ.
Ṣé fún mi mọ́nítọ̀ yìí? Àwọn ọ̀gá lọ leave. My father leave. Jọ̀ pásọ̀ ṣe yẹn nìkan. Jíyò, wọ́n ti bọ́ta. Then when did you go for leave? Or when is your leave? That's it. Say. That. Let's go 2 weeks. You know how many weeks? I should break it now. Okay, you got that. Every Monday, break in the end. And you got that. Please. Please, ẹjọ́. Àwọn àtàǹṣe gọ́ọ̀mẹ̀ntì máa sọ pé ọmọ ìjọba òkè kú. Àwọn mílíọ̀nù ṣẹ̀wọ́n lọ́dún yìí o. Wọ́n máa ń pààrọ̀ ẹ̀. Bí ọkọ̀ bá ṣe kindness, wọ́n á pààrọ̀ wọ́n á gbẹ́ lóògùn. Please, let's plan for you. If the church is not giving us, let them know the truth behind it. Because people the whole year, we are always engaged with one program or the other. Èyí ni Thursday, bóyá yẹ ká máa rest in vain, gbogbo la wá sí. Jíò, gba olè lọ leave sir. Please, ṣeré bí mo ṣe wò dáàdì, àwọn wọn tutù. Tí máa mọ èjì dáàdì, àwọn wọn tutù. Nígbà tí èèyàn 45 tó ti look like 60, ìsì ìnáwó àpò. Àwọn fóòtù yẹn kó máa wọ́n out. Please, let's take break. Ministry will continue. If you go for leave, look for somebody. Pastor mi kan sọ ọkọ kan láàárọ̀ yìí. Ó ní tó bá wù ẹ́, ìgbà táwọn ọmọ ọ̀gá wọn sọ pé ẹni tó bá wù ẹ́ máa fi gbogbo kọfí hàn wọn lọ́nà fún. Tí mo bá máa padà dé, màá wá yọ jáde, màá wá fà màá sí. Tó bá wù ẹ́, dá ìjọ rú. Ìgbà tí wọ́n máa dé màá ṣe kí ni? Wọ́n wá tún lò. Ìjọ náà wà á kọ̀ntínú. Tẹ́wọ́n mọ àwọn pásítọ̀ tó a máa ń pè ní pààyàn mẹ́ta. Wọ́n pààyàn lẹ́jọ́ mẹ́ta. Ṣé wọ́n sáré gba ìránṣẹ́ Ọlọ́run mi? Wọ́n ṣe lọ́n sí, lọ́n ti máa plan bọ́n ṣe fẹ́ gba ìlòmí. God will help us. Please, let's plan for ourselves. Not for now. Ara ń dàgbà sí ni, ó dè máa dàbí tọmọ kékeré sí ni. Nígbà tá a bá ti wá lọ́ra wa dáadáa fún ìjọ, tó wá tásìkò tó yẹ ká jókòó ká fẹ̀yìntì, ìgbà yẹn lẹ́lòmíì máa rán bíbí, lẹ́lòmíì máa rán ṣúgà. Ìgbà yẹn lẹ́lòmíì máa rán stress, ìgbà yẹn arthritis máa bu ẹlòmíì mọ́lẹ̀. That's 1 month. Kò ní kí jọ kó scatter as far as you are connected to God. Am I saying something? As far as you are connected to God, that 1 month, ohun tó ṣe ló máa tún yí padà. Kó já ṣọ́ṣẹ́tì náà lẹ́fi síbẹ̀. Please, break is very important. Tó bá gbé bàbá máa split bí 2 weeks ni, ẹ split it. Ẹ má dúró nílé o, kò lè bá dúró nílé wọn wá gbọ́rọ̀ bá yín nílé o. Bẹ́ẹ̀ ni, yóò ṣe leave. House arrest. Daddy, God bless you, sir. House arrest ni, they will come. Tọ́ba ti gbọ́ pé pásítọ̀ wà ní ẹ̀jọ̀ pẹ́sàrẹ́ yín sàn. Fún ọ̀fẹ́ mo bójú ẹ̀ ṣe rí. God will help us in Jesus' name. So we should make sure we take break and we should be prayerful. During the break, we'll be praying. Ọlọ́run á fi hàn wá ẹnikẹ́ni tó bá fẹ́ gbèsè tí ò yẹ kó gbé, tó bá fẹ́ gbá pátí ò yẹ kó gbé. Ọlọ́run ọ̀ṣọ́ Ọlọ́run òkú, ó máa fi hàn wá. Delegate duties to people. Don't put everything on yourself. Àwọn náà máa ṣe opening prayer. Àwọn náà máa ṣe ìwàásù. Pastoral prayer. Dedication. Kí ló tún kù? Thanksgiving. Birthday Thanksgiving. Ṣé tàbá tẹ̀lé kó ogun wọn sí òkè báyìí? Ẹjọ́ kan máa wá látẹ̀yìn kan máa wá lánàá. We are even training them. Mo rántí ayé bàbá Bọ́ládé. Gbogbo church member ló máa bẹ̀rẹ̀ ní pastor. Torí bàbá was training everybody. Ọ̀tọ̀ lẹ́yìn tó máa preach lọ́sẹ̀ yìí. Mo láwọn pastor kan tó tẹ̀ sí ṣe é sí. Mi ìlú wa para mi lọ́sẹ̀ máa gbọ́ tó máa sọ ní àwọn churches mi ti lọ lọ́dún fún medical talk. Wọ́n á pín ìlú wá ṣe ra mi léṣe. Pásítọ̀ Lágbájá ló máa mú Sunday. Èmi ni máa mú last Sunday. Èmi máa torí ọ̀fẹ́ last Sunday yẹn sí. Please, let's dedicate young people. Let them be engaged. When they are engaged, àwọn náà ẹ ti ń build wọn nìyẹn. But when you put everything, you are the one that will open the door. I go to this church this morning. Àwọn tájọ́ dé, wọ́n rí mi bí mo ṣe ń tẹnu wọn. Pastor Ayọ̀lékè wà bẹ́ẹ̀. Ó ṣe mo sọ pé so people can be devoted to work on this as a free-minded work. They were very busy. Àwọn tó wọ́n tó wọ́n, àwọn tó ti jíde tó ti gbálẹ̀ wọ́n ti gbálẹ̀. Èmi tí mò ń bọ̀ àwọn owó fẹ́ tí wọ́n máa ti ṣí géètì. Wọ́n ti kọjá wọ́n ṣí géètì gan. Let's train them to do something. God will help us in Jesus' name. Develop good habits. Develop a health habit, a good health habit. Don't just develop any health habits. Develop a good health habit. Regular test. Ká bá bèrè bí bàyìí sí pé èèyàn mélòó ló fi ṣe bí ìdí ní oṣù lọ́sẹ̀ ìlú àṣẹ ní òlọ́wọ́ yìí. Sá? Àná yàtọ̀ fún èyí sá. A lọ ṣe medical outreach ní 2 weeks ago. Nígbà tá a máa ṣe test fún wọn, ẹni tá a kọ́kọ́ ṣe test ta ṣe ṣúgà ẹ̀ jẹ́ 10%. Bàbá yẹn 10% bí o lè sọ fún wọn kó lágbára àgbàdì ẹ̀. Nígbà tí wọ́n á gbọ́ pé àwọn ọmọ ṣẹ̀dá láìsí tó ti gbé 2-3 months ago. Níṣẹ́ ni mo ní láti ẹ má bínú sáà ìjókòó bẹ́ẹ̀ wọ́n wá jókòó. Mo ṣáà wò ó nínú bá mi lókè tó kè wọ́n wá mi tó kè. Nígbà làwọn ṣe ń gbọ́ lẹ́nu pásítọ̀ pé ìgbà tó fẹ́ ṣe medical outreach yẹn nígbà tó ń deliberate lórí iye tó fẹ́ fi ra script wọ́n sọ pé owó yẹn náà máa fẹ́ pọ̀ díẹ̀ àwọn kan sọ bẹ́ẹ̀ tẹ́ ọba 60 ẹ̀wọ̀n bá máa ṣe gbìmọ̀ owó yẹn náà fẹ́ pọ̀ díẹ̀ kíní kan wọ́n ní bàbá yẹn wá ní owó tẹ́ ló fẹ́ pọ̀ yẹn 7,500 gbogbo nǹkan táwọn fẹ́ rà ṣé tí a ṣe ìkọ̀kan láàrin ara àwọn ṣé 75 yẹn máa kà láì mọ̀ pé bàbá tó sọ̀rọ̀. Wọ́n ṣé òtítí ìkọ̀bá tó ṣe wá before we check ourselves. A ní àwọn check ara mi ìdájí mo fẹ́ ṣe bọ̀ mo rántí bá kàn sáré bọ̀ nígbà. Even if you can't go to the hospital, have the BP apparatus at home, the quality one. Àwọn kan ti wà á tà sí lọ́yẹ́ pé when the battery is low, the thing will not drain. Òun lè tàn lóyè. When you are not in good posture, kò ní ṣe error ló máa fún yín. When you are talking, error ló máa gbé wá. Bó bá fọ́ọ̀dọ̀ ọwọ́ ẹ̀ báyìí, error ló máa fún yín. So it means we are advancing with technology now. Ẹ jọ̀ọ́, don't wait until when you have problem with yourself. Malaria kékeré tari yẹn, ó pààyàn 4+. Bẹ̀rẹ̀ máa tán àwọn ẹ̀ máa ń jáde báyìí. Àgbàlagbà wọn ti jáde lójú mi. Make sure you check your blood pressure, your sugar, your cholesterol, your prostate and others. Prostate is very, very important for the males. For the females, cancer, you should be free from it. You go for your cervical smear. They will take a sample from them. They will check if there is possibility of the person having cervical cancer. Do not ignore any sign. Do not ignore any sign. Once you see a strange sign, ó fi wà báyìí. Ibi tó jókòó yẹn ni mo ra jókòó sí o. Mo máa order fún ọ̀dọ́ bá fẹ́ order fún. Next available flight to the hospital. Please, nítorí pé a máa ń rí àwọn pásítọ̀ kan máa ń ignore sign. Tó máa sọ pé pásítọ̀ kan ó pààkì já lórí ìkójọ máa sọ pé ìkọ̀kan ti ṣẹlẹ̀ yẹn. Sígbà kan ti kọ́kọ́ wá wọn fura ọ̀wọ́ kọ́kọ́ wò pé ó máa lọ. Please don't ignore signs. So types of tests that we can run: malaria test, typhoid test, HIV, ẹlòmíràn náà máa ń jẹ níbi HIV yẹn, hepatitis B test, then blood group and genotype. Blood group and genotype. Kókó nípa máa sọ pé ó change kò change. God is a miracle working. He is a miracle working God. Sleep at the right time. Solution: sleep at the right time. If you are not having vision, sleep when you are supposed to sleep. You count your 8 hours. 8 hours in a counter. You want to put the label so you bed.
9 to 5. 8 hours.
9 to 5.
8 hours.
That is calculated.
9 to 5.
It's 8 hours. Go back to 10 to 6. It's 8 hours. Wamani in Nigeria will be. Eat good fruit. Eat vegetables. Good fruit. Vegetables. Ṣé wọ́n pé lè kó wá sí àní original fruit? Chemical fruit lání. Eat good fruit. Eat adequate food. Take enough water. Ọkùnrin at least how many liters? Pastor Francis. 4 to 5 liters. Ọkùnrin. Fọ́bìnrin 3 liters. 3 to 3.5 liters. Take the right drug you are expected to take. If a drug is not prescribed for you, orí fọ́ ìyá alágbájá jẹ́ kémi náà sáré gbà bẹ́ẹ̀. Please, what is wrong with ìyá alágbájá may be different from what is wrong with you. Don't take drug anyhow. Make sure you visit the hospital and be mindful of the quacks. The population of the quacks is higher than the registered ones. If I need quack doctors, no. I need quack doctors. Our registered nurse told the doctor they are quack doctors. Understand your body system. Your spouse is important to you. Your spouse, very important to you. Discuss with them. Have a good mind with them. When you have a good mind, you'll be able to do what? To discuss with them. Conclusion: it is good to take care of our body because it will help us to preach well and it will give us a good, healthy life. God will help us in Jesus' name. Amen. Do you have any question? Yes, sir.
stand up one day and just do any kind of exercise. Which type of the exercise as an adult can undergo? Because I remember a particular day that I wanted to do, I was doing exercise. I was doing this one. So that press or whatever. And I just do like this. Something just come like that. All I know is I was trying to manage to have somebody a place to sit down. I just kind of so we kind of exercise that I can do. And I'm not that myself.
We have a lot of exercise. We have a lot of exercise. But the best one is a stroll. A stroll. The difference of here, sir. Stroll, strolling around. Stroll. Sir? Well, they're walking around. Sir, ara ti ń yàtọ̀ sí. Ìgbà tẹ́mi ń gbá bọ́ọ̀lù, mo lè ṣe press up 150, mo lè ṣe 200, ṣùgbọ́n nísìnyí lè ṣe yọkọ̀. I'm still fit, very, very fit, but I can't do that press up again. I don't know if I can, but I have not tried for the past 5 years. So, strolling, singing, prayerfully, prayer walk. Pastor, me like prayer walk. Prayer walk is exercise. You know, everything is connected together. So you are just time exercise the wall. It is baseless the wall. So strolling is very okay. Everybody drop there. Skipping, money dancing, one thing smiling, exercising, you know. That is teacher for watching. That's not my daily watching. Any other question? Okay.
Please, can we pick a number for those who have those questions so that we'll be able to gather the questions together and share this one. Alright, then 1, 2, 3. Alright, just 3. There go. 4. Okay, that's grace number 5. Alright.
Get the question on you.
Praise the Lord.
Pátá mi fẹ́ bèèrè ní pé àwọn kan máa ń gbé kìíní tó fi ń tẹ́sítì your heart. Àwọn kan máa ń gbé kìíní yẹn káàkiri, wọ́n máa yà kí kán tẹ́sítì. Ṣé wọ́n lè ṣe fún yàn torí mò ń rò lọ́kàn mi kán bá gbé kọjá bẹ́ẹ̀ yẹn. Èmi ò ń pè wọ́n, màá ní rárá màá nítorí nọ́ọ̀sì lọ́mọ. Ṣé ó ṣiṣẹ́ àbí kò ṣiṣẹ́? Torí èmi máa wò pé gbogbo wọn kọ́ ni ó mọṣẹ́ yẹn bóyá ti di àti wọ́n fi lọ́ra.
Grandma, ẹ ti dáhùn question yìí. Grandma, ẹ ti dáhùn question yìí. Need you. You don't need them. They are not satisfied. Ṣé àwọn kwak sẹ́ǹsọ̀ yẹn náà, àwọn kwak náà, ẹ̀wù tá à ń bọ̀ lánàá pẹ̀lú ọ̀la, arojú ẹni wá fẹ́ gbogbo lọ́rọ̀ kwak because they go extra mile. Àwọn bàbá mi rè mí, I don't take delivery at home. I will not take delivery. Bọ́lá ṣe fún mi lórí ọ̀fẹ́ at least for 15 years now in service. I won't take delivery. Ṣùgbọ́n ẹ̀yọ̀ kan tó ṣẹlẹ̀ ní BCT Lagos ordained by God. Méjì ló ti ṣẹlẹ̀ bí city báyìí ìkan ànílé títí ilé yẹn my pastor is nodding his head Ọlọ́run ti fi hàn and he said God show you are now sending the patient to the hospital no you will take the delivery and the second one Ọlọ́run ló kọ́ and that was this year ibi tá a ti ní instrument tí yàn máa lè take the delivery rẹ̀ iṣẹ́ lọ́ọ́ gbà náà sáré dé kí ló lò báwo ló ṣe mo lọ́gàá Ọlọ́run ló ṣe. So, àwọn kwaki náà they go extra mile. Àwọn tó kọjá yìí wọ́n máa tajà o because somebody that is telling you that you are having BP bàbá kan wọ́n ló ní ṣúgà wọ́n wá fún lógún wọ́n tó gùn fún nígbà tí bàbá yìí máa dùn kódà kó dijọ́ kejì tí ìlògùn yóò wá sọ́sìpìtì wá sí general mo ṣe chẹ́kẹ̀ mọ́nà ṣúgà lọlẹ̀ bíbí yìí náà lọlẹ̀ ló bá ní oògùn yẹn ń ṣiṣẹ́ mo ní bàbá ẹ gbọ́dọ̀ gbẹ́sẹ̀ yọ kan tẹ́ bá gbẹ́sẹ̀ kan báyìí sí ní iṣẹ́ ọlọ́run ẹ bọ́ sínú kẹ̀ ṣe é bó ṣe dé oògùn yẹn ṣe fẹ́ gbẹ́sẹ̀ kan báyìí nọ́ọ̀sì ó ń lọlẹ̀ ní àwọn olùlọ díẹ̀ yìí so please you don't need them ẹ̀sìn gbọ́mà.
Mo kàwé kan tó sọ pé téèyàn bá exercise nígbà tó mọ̀ téèyàn bá kárí ẹ̀mọ́ kọ́nà téèyàn ti pín láyé láti ṣe exercise kan wà tó jẹ́ pé ìsìn láti ṣe lẹ́nu wíwà bí mi bá ṣe wà pé èèyàn mí sókè ahọ́n oúnjẹ àdàpadà sísàlẹ̀ jẹ́jẹ́jẹ́ ó lè bí mẹ́wàá tó bá tó sọ̀rọ̀ lẹ́yìn á tó ṣe pé because sometimes fún àtúnyẹ ìgbà tí ẹ̀ ń ṣe exercise breathing yín lọ́wọ́ yín àti gbogbo ẹ̀ ṣiṣẹ́ nígbà tí ẹ̀ ń ṣe yẹn náà o sọ pé kéèyàn capitalize lórí yìí pé ẹ̀ lọ́ conference kan wọ́n ṣòkè ní opportunity láti ṣe ìpínlẹ̀ pé iṣẹ́ pé ìwé ní ṣe kọ̀ọ̀kan rárá ni ó kú máa ṣe something ṣe deep breathing pé ìwọ mo wá dán wò rí mo pé tí mo bá ṣe tán mo máa ń fi ìlà mo mọ̀ bóyá ìyẹn kan sọ nítorí ni bóyá ọ̀rẹ́ bẹ́ẹ̀ ṣe.
Kò sọ nǹkan tó rí kódà tí mo sọ fún àwọn ọ̀gá ńgbà kan is a breathing exercise especially for the heart is a breathing exercise you will be relaxed with it. Mo fẹ́ lè lo ọjọ́ kan tí mi kì í ṣe even somebody that is hypertensive is good for them. Ìgbà tó dájú ni ìgbà tí ọba ṣe yìí. Like 10 times. Very, very relaxing.
Praise the Lord. I want to ask a question concerning water. Say we should take water ordinarily, at least 4 liters to 5 liters. So there's one doctor who was saying concerning water that when you are eating, you don't go to drink water. So after eating, you wait like maybe 25 minutes before you take water. So that one now, because normally I eat and take water. So is it affecting someone or how do you do it?
Build up one, the one we are trained are different. Èèyàn tó lè ṣe kọ́lé tó ti ń kọ́lé bọ̀ lókè tó ti gbédé ní tech ẹ wá ní kó wò palẹ̀ tó possible ó ti mọ lára. What we are used to we can continue with it. Me when I'm eating just one stroke of pepper last 2 weeks I took garri just one spoon tí mo gbé sí ẹni báyìí the thing shocked me immediately I drank water. So if we want to follow that a lot of people will suffocate o. A lot of people suffocate with it. What you are used to, I have a boss, my immediate boss. When she finish eating, 15 minutes, 20 minutes, ó jẹ́ ẹ̀wà àti bread onímúmi. Ẹ wọ́n sọ fún ọ̀gá mi omi rẹ̀ ọmọ ìyàwó yẹ kó ti yí ẹ̀. She will not drink water. She may not take water than 2 pure water for the whole day. She is used to it. But you see some people moving with keg of water all the time. So, my brother, what you are used to, continue. If you want to do that, there's possibilities of ṣé kúkú kúkú máa mọ ẹ̀bà yẹn náà will not be able to drink water. Iṣu tó ti gbẹ dry yam àbẹ́bà yíbò God will help us. So you can take water and the water cannot be too much on your body because the more you take water the more and ẹ má jẹ́ kí wọ́n deceive one being because téèyàn bá ti ń tọ́jú wọ́n lè lo tinitọ̀ sugar depend on the weather and depend on when you the last time you took your water. If you take water around 10-11 no you are going to.
Yes, you said we should not jump or when we wake up. So like that one, to how many minutes or seconds that we can use on the bed when we wake up before we get up from the bed or to attend to anything.
Now, from the research a doctor sent, he said 2 to 3 minutes. He said 2 to 3 minutes. Ìgbà míì àti máa ń jí sórí bẹ́ẹ̀ tà ní dìde. Ó lè tó 1 hour, ó lè tó 2 hours. Ó dà kó mo ṣe ní kọ̀mẹ́rin lánàá, bí 2 hours ni mo ti jí sórí bẹ́ẹ̀. Mi meditate o, mi pray o, kò mú wọn pé mo wà awake. Ìgbà tó kọ mi yọ́nà ẹ̀ẹ́sùn ni. Mi jẹ dáhùn, mi ìdáhùn, kò mú wọn pé mo wà awake fúnra mi. Depending on your body system, as long as you know that you can connect to the last thing you did yesterday night, that brain will function immediately. Be 2 months ago, I woke up. What happened? You know, almost started Jimmy Lantojo, and who she bought a bag. I felt this dizziness. I was just telling my husband, hey, would you be sure? Immediately I started with the breathing pattern. Mo mí sínú, ẹ̀tọ́ mo mọ̀ ń pa ìwé tí ó bá mọ̀ ń pa ìbó ṣe máa lọ rìn yẹn o. Mo mí sínú, mo mí síta. Ìgbà tó yá mo jókòó. Mo ní ẹjọ́ bá mi gbé ní BP. I checked my BP. It was okay. Ọkàn mi bá yẹn nílé. So I know when I woke up, mi ò relax dáadáa. So ibi tẹ́lẹ̀ gbọ́kọ́ fi fúnra mi ti discover research yẹn gbọ́kọ́ mi. So you can take 1 minute, you can take 2, but you yourself, you will know your body system is flowing well.
Okay, thank you very much. It's a wonderful teaching. I want to talk about prostrates. But before that, the idea of not taking water before food, it's the white man was trying to explain it. It's not what can work in Africa, because of the kind of nature we have as Africans. Like, there is something they call chewing your food until it becomes like a water substance before you swallow it. You chew anything you are eating, you must chew it until it becomes like a water substance. So by that, you can finish all the food, then wait for 25 minutes before taking water. For that kind of water. All right, I want to talk about prostrates. There was some group of doctors that they brought to our church sometimes, and it was very, very unfortunate that a lot of men that actually went through that test were actually victim of prostrate. At least I can count like 5 that was recorded. Pastors, don't let us joke with that prostrate test, because the doctor said is pastors are the most vulnerable because of the kind of assignments we do. We do more of shouting. We do more of stressful. We do of mental work. So we go through all this stress. Sometimes we don't take notice of some of these things. There was a day, I know we were all my church there, I was feeling pain all over this place. I began to bind the spirit of prostrate. I was feeling pain in my bronchus. I said, what kind of stupid pain is this? You know? And I don't have money to go for prostrate. So when that test now came to the church, I quickly came to it, and thank God I was free from it. So, but at least there were 5 people, men, who were victims of that. So that's my contribution. And I also wanted to talk more about it. Thank you.
When we are talking of prostrates, the enlargement of the prostrates, when we look at the diagram, the prostrate works with the sperm. If if somebody had prostrate, and because they want to remove the prostrate itself. Now, when you are talking of the causes, the one he mentioned is part of it. Another one is sex. Medically, we believe. Now, let me quote one of my lecturers. He said, at least for a man in a month, he must have sex for 21 times. And now, when he now said it, it's a big now take him. When he now said it, we now ask him. We now ask him that, you know, she try it. He now said from research. He said from research, that is the normal thing. You know, for every man, every day, you must have an erection. And when you have an erection, there's possibility you have all your having seeds. And these things they produce here. While they are producing, the body movements, they feel like having sex, and mommy is not around, or you are on the mountain, or you are praying, everything will go back and melt. So, and from there, there's possibility for such person to have infection accumulated teeth. That is where all those things are coming from one bed to another. Over there, we are not going from one bed to another. Our party. The little time we can spend, let's spend it. Don't look at yourself alone. Mommy too is very important. Cancer of the breast, the cervical cancer too. Those ones too are important. But most causes that medical picked out was the stress he was talking of, infection, and the sex. And thank God, that Baba is in there. What a woman, yeah.
Sex drive. Woman, they go. They are random. Open the bank and me 18 years. Then he was on that. But tell me, even if you can't too many books about it, the only thing you said now, no real, so no common, you know what you want. And it's okay, kilomita baba balagala bully, Timo, Shaban, no problem, 2 reasons, you know. Baba comes from a New York, but to battle very top, from tomorrow to you, or Nepalese. One more come on, come back. Especially àwọn bàbá abúlé yẹn. Wọ́n mọ ọkàn wọn kó ń bẹ pátápátá. Tó jẹ wọ́n lógún jù ó ní ìgbésí ayé àwọn ọmọ wọn àti kòkó fà oko àbí iṣu àbí tó jẹ wọ́n lógún jù nù. Ìwúlẹ̀ ìjọ tí wọ́n ti dẹ̀ dàgbà níbí kan ló ń kó lọ. But tí Bíbélì sọ kankan tí ìwé tí mo kà kankan sọ, wọ́n á fẹ́ wo owó tí mo ti kà. Bíbélì sọ wípé it's better to marry than to be consumed by passion. Consume yẹn, òun ni prostrate tí ó consume yẹn. Tí ara èèyàn bá lè ní gbogbo ìgbà, tàbí téèyàn lọ pornography film ní gbogbo ìgbà, tàbí tó yẹ pé ojú ẹ̀ tí ọkàn ìbáṣà ti ń jẹ́ kó ní erection, anything tó ṣe tí o bá ti ní erection kò ní problem. But tó bá ti lè máa ní erection, because the moment tó bá ti ní erection ní èsì medical person, the moment tó bá ti ní erection, fan production, ó máa wátáyé. Tó bá lè ti lè wátáyé tí o dìrí bí kan dà sí wàhálà. But tó bá lè gbàdúrà kákó jẹ́ pásítọ̀ ńsì tó gbàdúrà pé kọ́nà òun yọ kìnìún ìlọ́kàn tí èrò mú nípa ẹ̀ rárá àtọ̀ kò ní ní erection. Nígbà tó bá lè ti ní erection. So kúkúrú bẹ̀ ni pé once there is no erection, there cannot be problem with the but once there is erection and you don't ease it, then there is a problem.
Thank you, sir. I mean,
All right, let's celebrate.
Thank you, sir.
Let's celebrate Mrs. Esther Abraham. Let's